Okay, we're going to take up to hemolytic reaction, autoimmune or immune hemolytic anemia. So we have here the PNH. Another one we have here the PCH. So first we take up here the PNH. PNH stands for your paroxysmal nocturnal hemoglobinuria. So this is a type of your immune hemolytic reaction which try to occur during the night time. That's why being called here as your paroxysmal nocturnal hemoglobinuria. So the lysis of the red blood cells here try to occur during the night time, and this one is complement mediated. It is the complement responsible for lysing the red blood cells during the night time. So being a hemolytic anemia, so it would have here the following manifestations. It would have here your hemoglobinuria, hemoglobinemia. It would also have here your jaundice because of the red cell destruction. Would have the splenomegaly and would have also the thrombosis. Okay, so the pathology related to the lysis of the red blood cells here with the PNH because of the complement mediated. So basically the red blood cells here of the patient would have you the absence of the following factors. Okay, the first one, we have your acetylcholinesterase. Acetylcholinesterase level here is directly related to the severity of your PNH. So the more decreased or the lower the concentration of the acetylcholinesterase here, the more severe your PNH. So the most important one here would be your DAF decay accelerating factor. Decay accelerating factor is needed by the red blood cells that try to protect the red blood cells against your complement. Okay, so it will protect here our red blood cells with the bystander effect of your complement. In the absence of the decay accelerating factor, once complement is present in the plasma of the patient, it will rupture the red blood cells. That's how protective your decarcerating factor is. So for those patients having the PNH, they don't have the decarcerating factor. And therefore, once complement is present, it will bind the red blood cells and it try to cause lysis. Other factors here which are lacking in the red blood cell membrane, we have your homologous restriction, factor 8 binding protein, and we have also your MIRL, membrane inhibitor of reactive lysis. Okay, so again, this would have your increased sensitivity to complement. Again, the complement will be the one responsible for lysing our red blood cells. So it would also have here the pancytopenia, and we have here the thrombotic or thrombus formation is a clot formation. You call this one other name for this one. Okay, our PNH will be the Budd-Chiari syndrome. Okay, we have here the two tests that will try to screen for the PNH. So the screening tests, we have here your sugar water test. This is with the use of your sucrose. And we have also here your confirmatory test is your acidified serum test. Okay, and that one would have here the, or other name for that is your Hams test. Okay, for the both tests here, both tests, our sample for that would be the red cell suspension of the patient. So you need to you need to extract the blood, citrated blood. Okay, you try to put it one in citrate na blood and then try to prepare a red cell suspension of the patient by washing. Okay, and try to produce here 50% na concentration ng red cell ni patient. Then your reagent for that is a serum. The serum here should came from a normal na patient. Okay, for your sugar water test, okay, so the serum here of the normal patient as your agent, you need to add your sucrose. Okay, and you need to buffer your sucrose here at the pH of 7.4. Okay, so we have that one with 10 grams of your sucrose plus 100 ml of your distilled water. And make sure that the buffer of that or the pH of that should be at 7.4 na pH. So we have that one. So your sucrose solution or your serum for the patient added with the sucrose here, 0.1 ml. Then ito ang, okay, this would be the sample here coming from the patient. You prepare the rest suspension, 0.2 ml. Then try to incubate at 37 degrees Celsius here at for 30 minutes. Okay, and then after that one, try to observe for the hemolysis. Again, if The rest of the patient here, since red cell ang ating reagent, if the rest of the patient do not have those factors, basically your decarcerating factor, the serum here contains this complement. So coming from a normal patient, so expect that one to have the complement. So the complement will bind with the RBs to the patient, so wala siyang decarcerating factor. And the binding of the complement is mediated by your sucrose potentiator in the form of the sucrose. And then once the complement bind with the RBs to the patient, since the RBs to the patient do not have a decarcerating factor, it will lyse the rest of the patient. So that will have your hemolysis as the positive result. Your acidified serum test or the HAMS test would also have the same procedure, only that your serum here as your agent is being acidified by addition of your point N hydrochloric acid. Then try to incubate that one with the patient's rest suspension. Incubate to 37 degrees Celsius here for 1 hour. And then try to observe for the hemolysis. So, ganun pa din naman siya. Hemolysis pa din ang positive result natin. Only that, again, ang principle nito ay ang ating serum the patients or serum of our normal serum is being incubated with your 0.1N or being acidified, I mean, with the 0.1N hydrochloric acid. Allow that one to react or to be incubated along with the patient rest suspension and then try to observe for hemolysis. Okay, then we have here the result of your other tests. Okay, primarily here with your, comparing with that with your PNH. So the spherocyte will give a positive result here in your HAMS test. Only that it will give a hemolytic reaction in the absence of the complement. Mean to say that one is not complement mediated. On the other hand, your PNH would have here a positive result both in your water sugar test and your HAMS test. Again, that one is all mediated by complement with the absence of those factor. HEMPAS, on the other hand, or hereditary erythroblastic multinuclearity with a positive acidified serum test will give a positive result with the HAMS test only. Only that it will give a positive results here with its own serum, ang ating sa sarili niyang red cell, sa sarili niyang serum. Unlike with your PNH, sarili niya, the patient's here na the patient's red cell versus here the normal coming from another patient, ang serum natin na reagent. Ito sa kanya, sarili niyang red cell, tapos sarili niyang serum ng patient. Okay, we have here false positive results. Number 1, so, okay, the complement, your agent na serum, coming from your patient, or coming from the normal patient, do not have the complement. So, of course, it will be a negative result because it is complement responsible for the lysis complement ang nagle-lyse. So, ang ating reagent dapat should contain here the complement. Okay, that's why dapat fresh ang serum coming from your other patient, coming from the normal na patient. Okay, the second one, use of your unbuffered na sucrose solution. So it should be buffered at 7.4 because this one is your potentiator, allowing the binding of your complement with the red blood cells. And that's why you need to prepare here your sucrose every day or every time you're having the tests performed. Okay, the third one, recent massive blood transfusion coming from the normal patient na blood. So expect that one na magne-negative siya because the rest of the patients is normal. Because part of that is coming from your donor na blood. Okay, the false positive. Okay, so remember that we tend to observe here for the hemolysis positive result. So the patient would have here hemolytic na or hemolyzed na blood sample because of your hemolytic puncture. So expect that one to be having a positive results, but it's a false positive. Another one, severely anemic patient. Third one, patient having other immune hemolytic anemia also give a positive result for this. Okay, the next one, immune hemolytic anemia, we have here PCH, paroxysmal cold hemoglobinuria. Paroxysmal cold hemoglobinuria is identified by the presence of the biphasic na hemolysin. You call this one your Donat-Landsteiner. This one is a biphasic because this is a lysine, hemolysin, which tend to bind the red blood cells on a cold temperature. And Once it's already bind with the RBC in the cold temperature, if you try to expose that one at the hot temperature or less or at 37 degrees Celsius will cause lysis of the red blood cells. Okay, so however here hemolysis is hemolysis is taking place in your non-acidified na serum. Okay, so we have your different method for that. We have your Rosenbach, Sanford, Donat-Landsteiner. So we have here the procedure for the Donat-Landsteiner called hemolyzing method. So you're going to prepare here for the sample of your patient and we have your negative control. For the patient sample, 10 drops of the patient's serum. Then you add here type O suspension coming from another patient, which is a normal na patient. For the negative control, 10 drops of the normal na serum. Then, of course, here, 1 drop of your type O resuspension. Both of this one, try to incubate into temperature 1. In the melting ice, that would allow you to facilitate this one at a cold temperature. Remember that at cold temperature, your donut Landsteiner tend to bind the red blood cells. Okay, and then after that one, incubate at 37 for 1 hour. So ito na-expect natin na result. If the patient has the PCH, if you try to incubate that one at cold temperature, it will give a negative result. But after incubating that one at room temperature, it will give a positive result. Of course, pag normal, so negative, negative siya. Okay, so that's it for our PCH. Thank you.